Good evening, ladies and gentlemen. Welcome. Such a pleasure to be here today again. It's 4 p.m. here in Valladolid, in Spain, and hopefully it's, I don't know, morning for you or night if you're watching this recording. And but be sure that it's a pleasure for me to be here and honored to host today our fifth and last episode of this season. This is number five, and I've prepared a couple of pills for you in case you don't make questions. As you probably know, our intention with this clinic is that if you have any problems with medical translation, I mean, not probably not a term because I'm not a dictionary, I may look like one. There are many books here, but I'm not a dictionary. So if you have any questions which you think I can help you regarding our job, our the clients, what a CRO is, where to look for words, where to search for job or for work, anything like that, or how to start a medical translation, maybe. I'll be happy to answer after we take our pill, like every second Tuesday of the month. Remember, this is our last episode this season, and we will not be broadcasting during the summer. The summer in this part of the world, and if you're in Argentina or in Mexico or Venezuela or in America, South America, and Central America, not South America, you're going to the winter now. Um, Good luck because flu is there, COVID is there, ape, monkey, smallpox is there. Well, not a very good time for getting sick, right? So please, please, please take care of yourselves. Here you have Gilberto Gomez, who's at Mexico City, la Ciudad de México. Qué bonita la Ciudad de México. And so it's morning there, right? Morning. And so please take care of yourselves. Keep on being careful with all hygienic measures. I know you're fed up with the masks and the gel and everything, but I would not advise. Just tell me common sense is to keep on using them, particularly when you're indoors, and be very careful because, for instance, in Spain, in the time in this 5 months of 2022, we have had much more dead people from COVID than we had when the first wave. That those are the figures. That is what is happening. I don't want you to be afraid. We shouldn't be afraid of anything, but particularly this thing, because we have the possibility to take measures and to be careful. We have all the information. We have the vaccine. We have everything. So even though people who's vaccine and is taking all the measures, they get the infection. So please be careful and be here when we are back. I will share with my screen with you so that we can start to no, this is not compartir pantalla. Um, um, Here we go. Compartir, and this is that every second Tuesday of the month we have been providing to you Dr. Mugüerza's clinic and an appeal, and this is a little advice on translation. American translation pill every second Tuesday of the month. I have prepared two today, and I hope you may question because I don't have any more. In case I finish, we will have to finish this presentation today. And I would like to talk to you about the translation of the verb to make sure, or the expression to make sure, and the verb to ensure. You probably, if you have experience in medical translation, probably you've realized that these two verbs, if we call them different verbs, have become so often in our specialty. Sorry, they are so common now that if you go to instructions for a patient, for instance, or even for a device. You have a device, and you have the handbook, the user guide, right? And you have the instructions after instruction, probably many pages of instructions. If it's a, I don't know, you have to translate the user's guide of a huge MRI device at a hospital. And believe me, that the user's guide is a book, right? Many words, and you have to translate that. You will find a lot of ensure and make sure. And I want you to think for a minute about the translation of those two words to the languages you translate. If you are translated into Spanish and you're in medical translation, the first thing will come to your head, and that you will find in the memory, in the translation memories in your tools, will be asegurarse or asegúrese. And although this is, as always, it's expanded in Spanish, in medical Spanish, in all kinds of Spanish, but particularly, what we do in Spanish, medical Spanish, it's expanding, and we are getting, in many of your countries, you're getting so used to it that you're using it without thinking. My objective today is to think about it a little bit. Okay, you can translate make sure and ensure by asegúrese o asegurarse. S'assurer en français o sicurarse, no? In italiano non sono. I'm not very sure, but anyway, please always remember that I'm very biased when translating. I only translate from English into Spanish, but you can follow my reasoning, right? So you find these so common verbs. Remember that in English they are not afraid on contrary, they encourage repeating a verb all the time in order to make emphasis. So that's how they understand it, and they will always say encourage, ensure. So if you're talking about a medical device, ensure that the plug is on the socket wall, ensure that the screen is clean, ensure that the patient is lying on a sofa or on a surface, ensure that the patient won't move during the procedure, ensure. We have some margin here. We have some space for creativity in a way, and to make it more comfortable for readers. And of course, if there's a lot of ensure one after the other, maybe you opt for ensure, but you have many other possibilities. Think of the sentence you can read there. Ensure patients will take their medication daily. Ensure patients make their medication daily. Most translators I know will directly say asegúrese de que los pacientes toman la medicina. Why not check? Compruebe que los pacientes. Why not investigate? Why not? We have many possibilities. We will see them later. And if you're not following a list, as I told you, ensure, and there is a logical there, and you want to be sorry, forgive me, and you want to be consistent in the translation, there's some margin for creativity here. In this case, ensure patients will take the medication daily. Compruebe, asegúrese. Well, we'll see many options later. There's another second example here. If you choose to leave the study, make sure you don't forget to fill out the following form. This make sure is completely avoidable. You can say, si elige abandonar el estudio, si opta por abandonarlo, no olvide rellenar el siguiente formulario. No olvide. Entonces, asegúrese de no olvidar. It's very English, it's very medical English, and they do these things, but we are not machines. A machine will do probably. No, asegúrese de no olvidar, o compruebe no olvidar. We can, many times, we can just avoid the translation of make sure, and don't do it. I see I have more examples here. To ensure in English, let's say that in English they are almost synonyms. In most of the examples I have been collecting for this presentation, they say that to make sure and to ensure are strict synonyms, right? So let's talk about both of them as of one, right? So to ensure is to make certain that something will occur or be the case. Like the client must ensure that accurate records are kept. El cliente debe garantizar, I would say here, that accurate records are kept. El cliente debe garantizar, debe ocuparse de que se mantengan registros. There are many possibilities. I've written in Spanish, probably in the language, your target language also. So again, my objective is not to give you a guideline or an order or an instruction. No, my objective here is to make you think about these two verbs, to ensure, to make sure. Another meaning of to ensure is to make certain of obtaining or providing something. Legislation to ensure equal opportunities for all. Esta ley dará las mismas oportunidades a todos. They are not saying giving, they are not saying to give or to provide. They say make certain of obtaining the legislation to ensure equal opportunities. We say dar oportunidades in Spanish, better than asegurar oportunidades. Again, I'm not giving instructions. I'm not giving a single way. I'm just trying to open your minds in case you need that. Another meaning of ensure is to make sure that a problem does not occur. So you can say, for instance, only by researching stocks thoroughly can a client ensure against being misled. Solo investigando las reservas, ¿no? Lo que uno tiene exhaustivamente, podrá el cliente estar protegido frente al desabastecimiento. O perdón, a que le engañen, ¿no? Estará solo o a ser engañado, a verse engañado. Como ven, en todos los casos intento no utilizar asegurarse. In all cases, I'm trying not to use this for Spanish form and probably the equivalent form you have in your target language if it is not Spanish. Let's have another. Here you have other options for even in English. Even in English, you can say, for instance, ensure your patients will fill this form. Don't forget don't forget to remind patients of filling the form, for instance, or to guarantee, or to achieve, to attain, obtain, procure, do whatever thing is possible for, to see, to facilitate, to favor, ascertain, or check. You have all those possibilities in English if you are a writer. But what happens in actual documents today is that they are all using make sure and ensure. So don't forget to think about this, to take this into account. Maybe your choice is make asegurarse in Spanish, or to make sure or to ensure. You have again the sentence here, the one I said before. If you choose to leave the study, make sure you don't forget. In this case, you can avoid completely the translation of make sure. And I would like to say as well that there's a very similar verb that you shouldn't confuse. It's the verb to ensue, which means to follow, to happen, and to result. Be careful, because the context will not help a lot, and occasionally you can find in the same sentence ensure and ensue, and you have to be careful because they are different. I wonder that I have some questions here. I will try to answer them. Meltem Time Terkume. I wonder that about fundamentals of medical translation. Can you give I wonder that about fundamentals of medical translation on abroad. Can you give me some examples? I'm sorry, Melton, but I'm not sure I understand you. I wonder that about fundamentals of medical translation on abroad. You mean different other languages? If you're asking me for examples into German, probably I'm sure. I'm sorry, I haven't got them. My German is almost forgotten. I studied a lot. I mean, that I wasted my time because I studied a lot of German. I used to love it, but I'm not able now to produce examples on that. But Meltem, anyway, um, my advice today is that whenever you find ensure in English, or to make sure you think before translating it automatically, as a translation memory would do, because there are many other possibilities, and you have them on the slide. I'm sorry, I can. If you are so kind to repeat the question, I will have to rewrite the question. Maybe I would understand better. Maria Florencia Blanco Cabrera says, I remember you talked about this topic during a course you offered with Juan Macarlupo. Thank you so much. Totally agree with you. Thank you, Maria Florencia. This is important, and this is the kind of issues, of tips I like to give. Those you don't think about, and you think that automatic translation it's okay, and we let me be a bit American now. American in the sense of the coming from the United States. Thank you, Malcolm. Thank you to you. Sorry, I was saying that from the American point of view, I try to give tips to you which make you think a bit, and to make you be different and be better than the translation memory. Of course, the translation memory is usually right, but it's poor. It's poor and maybe wrong, of course. But I was saying something about America, but I forgot. I'm sorry. So use all these possibilities, and always. But yes, I was talking about excellency. We machines and translation can hardly search for excellency in their translations. We can't do that, and it's our job, and we have to make a difference with machine translation. Here, and the tip, and with these tips, you will find chances to be better than machine translation. I'm collecting all these tips in a book, which will be one day, I don't know, after the summer. I have collected like 110 small tips like this one. And well, if you follow translators, and me, after the summer, we will have more about this. So that's all for the first spiel. And thank you for your questions. In case you have any more, we will go ahead. But let me talk to you about a term that also you may translate without thinking about it, right? It's a very common one, and it is tracheotomy and tracheostomy. You probably, I don't know if you know the difference. Before seeing the drawing, I've included here, but a tracheotomy, which is what people use everywhere, in films, when there is someone choking, and there's something obstructing the air, the air paths, the trachea or whatever, something blocking the patient has swallowed meat and it's stopped there, or it's choking somehow. And the only solution is to make a hole here, to make a connection between the inner of the trachea and the exterior, so the air can go passing before the patient dies. So you have to do that. Well, before you make the hole in the trachea, you need to cut a little bit. I mean, this is an emergency. Maybe you don't have time, and you will have to be a little bit animal, and make the tracheostomy like that. But if you're going to do it properly, and you have all the medical devices at your hands, then you will first make an incision with a knife, right? An incision with a knife. That incision is what we call a tracheotomy, technically. Then you will use a tube, a cannula, or a kind of tube to passing through the hole you have created, and this tube will connect the inner part of the trachea with the air outside, and this tube, this is the tracheostomy. So you have here the tracheotomy is the surgical incision on the wall of the trachea. You can see it here, the top right corner. And you can see then the tube here, air passing freely through the tube, and this is a tracheostomy. A tracheostomy. What happens? This is the most common situation in medical translation from any language into any other. There are two words that, and there is a theoretical difference between the two of them. Our obligation as professional medical translators is to know very well the difference. But what we find in the current use of the words is that most texts use them as synonyms. So be careful, because you can find a text where tracheotomy and tracheostomy are used as synonyms. Or maybe they're making a difference. That's what, again, the medical translator better than a machine, being better than a machine, and we are able to make the difference if the text is making the difference. Okay, so be careful when you read these terms. Pay attention, and please realize that probably if you go to a conference by a doctor, a physician, talking about any other thing, maybe they mention tracheotomy and tracheostomy, and they will use them as synonyms. It's the same with gastrotomy and gastrostomy. You can have a gastrotomy, and that means that you are making an incision in the abdomen to reach the stomach, in order to reach the stomach, and then you will insert a cannula or a tube or any device in order to, as you can see here, feeding the patient. In this case, usually is to provide feed to the patient. There's a problem in the esophagus or in the pharynx or in the mouth or wherever. So food is prepare food. Obviously, you don't get a steak, right? And smash it and then inject it. No, you take a kind of special food prepared and you inject it directly in the cannula, insert it through the gastrotomy, and that is a gastrostomy. It's interesting because, as you can see here, here. Yes. And the second line here, you see that the tracheal, this prefix means it makes reference to the neck, to the throat, right, and the actual neck, or to the cervix. In the uterus, the part which is inserted into the vagina, which it's showing there by the ectocervix. So you find that tracheotomy, we had tracheotomy, tracheostomy, and we have now tracheotomy. In this case, we're not talking about the neck, then the neck here. We're talking about the cervix, which is also called the neck of the uterus, of the uterine neck. So be careful. I mean, I don't think the context will ever drive you to a mistake, because it's completely different talking about the neck with the throat and the carotids and all the arteries and all that, and talking about the cervix in the uterus. But you have to know that tracheal, this part of the word, this prefix, or maybe another part, makes reference to neck. Both necks, right? Since we are here now, I will go back to the tracheotomy and the tracheostomy and let you know that in English, they make a difference between what they call cricothyrotomy and what they call cricothyroidectomy. There's words which are difficult to pronounce. As you have the explanation there. I will read it for you. It says that the emergency surgical technique performed for the same purposes as the tracheostomy, but when it is done through the cricothyroid membrane, probably you know that there is a lot of things here called crico. It's starting with crico, and you have the cricoid cartilage, the cricothyroid membrane. They are the parts of this cartilage, thyroid cartilage, and they have the cricoid stalk cartilage. There is a lot of anatomy there. We tried to explain that when we talked about fundamentals of medicine for medical translators, and we are talking about the respiratory, the airways, and the digestive ways A cricothyroidotomy and a cricothyroidotomy are the medical surgical technique performed for the same purposes as a tracheostomy, but through the cricothyroid membrane between the cricoid and thyroid cartilages. I told you this. There are cartilages here. You can tell them. One is called cricoid, the other one is called thyroid, and it corresponds exactly to a inferior laryngectomy. So you can, if you're trying to solve the problem of a patient who cannot breathe because something is in their throat and it's preventing air to circulate, you can try to make this hole, this first tracheotomy, then a hole in order to pass as a cannula. You can do it up. They can do it. You don't do it. Of course, probably you've lived situations where someone had to do it, and the outcome for the patient maybe is not very good when someone who is not trained to do this procedure. The situation is an emergency. Everybody wants to help, so give me a ball pen. We used to have Bics, what we call in Spain we call the ball pen called BAC, and they are adequate for a tracheostomy, right? Because if you don't have a cannula, it's an emergency situation. Your son is about to die because he or she is choking. You do anything. So this can be done if you are doing surgically and properly and in a medical environment, in a clinical environment. And you can do it at several levels: laryngectomy, tracheotomy, and also an inferior laryngectomy, and that correspond to a cricothyroidotomy or a cricothyroidotomy. Despite what has been said, despite what I've said, English-speaking physicians usually call emergency tracheostomy or emergency tracheotomy. They always use the emergency before. Of course, it's difficult. It happens also, but there are elective tracheotomies, and they can. The patient is, I don't know, I can't think of situation now, but maybe things are not exactly an emergency. You can be careful and do things slowly, plan and have an operating theater, everything clean, gloves, washing hands, mask, everything. Maybe that may happen, but most of the time, a tracheotomy, regardless the level at which, or the level of the neck at which you're performing it, is an emergency procedure. So what you will see always is an emergency tracheostomy or an emergency tracheotomy, and it's your decision to use emergency in your target language or not, because probably the context is enough to let the reader know that things are that it's an emergency. So probably you don't need the whole name, an emergency tracheostomy. We are in an emergency. We are in an difficult situation. The patient is choking, so we just did tracheostomy. And that is all about my pills today. I hope you have made a good idea about the verbs to ensure. Yes, Paula. Yes, Paula Couvertier is asking if this presentation is going to be available to watch later. Yes, it will be. It will be in YouTube forever, probably. But it will be in YouTube. It's very easy to find. You just write Dr. Mugüerza's Clinic, and you will find our previous four episodes and this one today. And yes, I'd say it's very advisable always to rewatch, particularly my presentations. Always there is too much information, and it's not all written, not all speaking. It's if you want to get the whole idea of my presentations, you need to remember what you heard and what you read on the presentation. So it's a good idea, Paula, if you can, to rewatch it again. And remember, my objective is to help you to think and not to give you strict guidelines. Thank you to you, Paula, for asking. Not to you strictly guidelines. So, but this is something that I see all the time. The older I get, the more I review more than translate, because probably because of the years I've been doing this. Clients trust me, trust more my ability to check if the translation is all right than taking my time translating, right? Something like that. I don't know, but I'm always correcting, changing, reviewing, correcting, and I find that, of course, that you are used to look up at dictionaries for difficult terms, uncommon terms, those who are you don't understand. But if your career, your professional career as a medical translator is properly devised and you're doing what you have to do, you will learn that the older you get and the more experience you have, the more you will look up dictionaries, or you will research every time more. I will be 60 years in September, and currently I look up much more, and I research, and I browse the internet, and much more than I did when I was 30. Of course, when I was 30 years old, there was no internet, so I couldn't browse a lot. But but it's I can tell you my own experience. There was a time in my life as a medical professor, as a medical translator, when I used to say, "Well, sure, asegurar, no problem." The more you look for this so automatic translation, like ensure, like I don't know, the translation for to do or to make, or to, those very easy verbs that you think you know very well. When you have a bit of time, please check them. Look for them in a dictionary, and try to see how they adjust in English and how they adjust in Spanish. You will find always that you increase the number of possibilities, and you don't make critical translations, because we are critical. It's part of our the essence of of our job as translators is to doubt of the equivalences. Right? You go to a dictionary and you see there, this is in English, this is in Spanish. Our job, our role here is to doubt about that, and to say, maybe there's something better, which is not exactly what is here in the dictionary. That's what I've been trying to present to you in these 5 episodes of Dr. Mugüerza's Clinic. And if you want to go to YouTube and right there, Dr. Mugüerza's Clinic, you will see them, and I will be happy if you do it. If you don't have more questions, I will confess you that today's not a very good day for me. I have a terrible pain in my foot with gout. You know what gout is? It is something for old people, and I'm really suffering a bit. So if you don't have more questions, I will appreciate if if we can finish now. And maybe when we come back after the summer, I will be in shape. Not like today, which I told you I don't feel very well. So thank you very much. It's been such a pleasure to have you for this 34 minutes. Please visit. This is very important. Please visit TranslaStars website. There are many options for medical translators. You have courses, you have tutorships, you have mentorships. You have not only medical translation, of course, you have all kind of translations. You have also like this presentation and these live translations. You have them about finances and the economy of the translation company. You also have Alfonso Bartolesi with his podcasting live. I hope he's doing that with about SEO. Maria Florencia, thank you very much, Pablo. It's always a pleasure to listen to you. Thank you to you, Maria Florencia Blanco Cabrera. I think I remember your name from many other presentations. Thank you for asking and for being there all the time. Visit TranslaStars website, see all the opportunities they have. Follow them and me on Twitter and on Instagram if you want. What is it? My Instagram account is quite private. So it's not very interesting to follow me. I always post food there, and my cat and those things. Not very interesting. But translators have a lot of activity, professional activity. Also on LinkedIn, we are on LinkedIn. We're working a lot on that website, on that network. Join us, follow us, and make this our community larger every day. Meanwhile, have a nice summer, have a nice winter if it's possible, and please, please, please take care of yourselves. Goodbye for now.